Hemorrhagic stroke means that the patient had a bleed in the brain. There are two types of stroke. Well, we can call it three. Embolic stroke, where a patient breaks off a piece of cholesterol plaque and it goes into the brain and causes a stroke. You can have a thrombotic stroke where the artery is closed and that causes a stroke. And then you have a hemorrhagic stroke where there is a bleed. Usually hemorrhagic strokes have a worse prognosis. Why? Because the extent of bleed is going to determine whether the patient is going to survive or not. Hemorrhagic stroke can initially present as a mild symptom and then they can bleed even further. Therefore, they can expand the stroke. So once again, you need to find out what the cause of the hemorrhagic stroke is. Is it an aneurysm? Then the aneurysm needs to be fixed, or it needs to be diagnosed before they have a stroke. So what kind of symptoms do you get with aneurysm? You'll get chronic headaches. Therefore, patients who have no clear reason for having headaches, but they're having constant headaches, they have to be tested for aneurysm. 2, blood pressure. If they have significant elevation in blood pressure, then they have a tendency, have a higher risk of getting stroke. So blood pressure management is important. So those are the things that are preventable that we can do to prevent hemorrhagic stroke.